Moments of achievement.
Tranquility Base here. The Eagle has landed.
Liftoff comes up. The Coons win.
Of revolutionary change.
Free at last. Thank God Almighty. We are free at last.
Of profound breakthrough.
Lasting peace in Northern Ireland.
Of being the first.
Amelia Earhart proving women could match men.
I accept your nomination.
Of the triumph of the human spirit.
Mr. Nelson Mandela, a free man, his first steps into a new South Africa.
Those moments of joy and pride and accomplishment. New struggle. And frustration. They came out of anger and pain. They were born from defeat and the need for defiance.
The public schools of Little Rock.
What has always led us to overcome these challenges is a decision to act. That decision can be burdened by the weight of history, or it can be the simplest act of putting one foot in front of the other.
Every day is a choice. Every day we all make a decision.
It is the power of what we do with that choice, our commitment to act, that drives the Clinton Global Initiative community to change the world.
Look at all the good that's been done because you made a decision about what to do with your mind and your heart.
We choose to get back up.
We have superhumans on the streets of Ukraine, not victims of war.
We choose to reach out to others.
Big problems have very simple solutions. Start cooking and start reaching the people.
We choose to recognize the infinite potential of the smallest moments.
If we want to create a sustainable and safe future for children, we must start with education.
Go and create the future you want to live in.
We choose to solve problems.
We need to invest in people where they are because they're going to invest in everybody else around them.
Our values call us to put people first and the ecosystems that support them.
Power to the people.
We choose to embrace innovation.
Solving these challenges requires collaboration and innovative thinking.
If we don't work together, it doesn't get done.
We choose to stand up and seek justice.
The world should be standing up for freedom, and it has to start in Ukraine.
We choose to see the world not how it is, but how it should be.
We are in this race between hope and fear, between decency and cruelty. It's a moment for all of us to fight for a better life for all.
This is a global responsibility, an obligation, not an option.
We choose to hope.
All these little things some people may say are incremental turn out to be a great big mountain.
We choose to keep going.
I was remarking to Alan how wonderful it was to be in a place where there was so much appreciation for Billie Jean King, because a room clearly also in this pavilion applauded just as she came on to screen. So I feel very much at home as someone who has always found enormous inspiration from our extraordinary athletes, even though I possess not even an iota of their talent, and to be in a community of doers. We at the Clinton Global Initiative are so grateful to have this conversation in partnership with the UNFCCC today, and know that we have a lot to cover, so very much want to get to it and kind of ask our panelists to join me on stage. So Angela Naef is the Chief Research and Development Officer for Reckitt. Pam Cheng is the Executive Vice President of Global Operations and IT, as well as the Chief Sustainability Officer at AstraZeneca. And Alain Dangour is the Director of Climate and Health at the Wellcome Trust. Could you please give them a round of applause? Alan, I want to start with you. We're here today, so we clearly understand the kind of intimate connection between climate change and health. And yet, I know kind of Wellcome, as well as many other institutions represented in this room today, have kind of talked about the frustration in kind of the absence of many policymakers to understand kind of the connectedness between kind of these two existential challenges. And I know Wellcome's very focused on kind of what are the questions, what is the evidence base that we need to be kind of building to then marshal that to help policymakers understand the connection between climate change and health, and why a focus on health has to be part of addressing climate change.
Fantastic, thank you, and thank you very much for inviting me today. It's a great honor. I would start by saying I think the tide is shifting. I think the tide is shifting, and it's incredibly exciting. We have today the first Health Day in 28 COPs. It's a huge moment. It's a huge moment, and it's not just, we're lobbying on the side or people are saying health is important. There are more than 50 ministers of health here today. Yesterday, the Health Declaration was signed by more than 123 countries, recognizing that the health crisis, that the climate crisis is a fundamental health crisis. For those of you that were at the opening session of Health Day today, John Kerry stood up and said, the climate crisis and the health crisis are inseparable. And then he said, our failure to act on that is lunacy. Now, he's a very important man. I'm quite happy to believe him. Obviously, that is my job as well, to say it's absolute lunacy that we're not acting on these two fundamental crises of our time in the same breath. As the environment changes, so our health is being fundamentally challenged. Whether you saw just some very motivational images there, whether it's the impact of extreme heat, whether it's the impact of the spread of infectious diseases, whether it's the impacts of extreme weather events like fire and floods, it's the poorest communities in the poorest countries that are suffering the most. And of course, they are the ones that have done the least to drive this climate change. So at Wellcome Trust, Wellcome is a funder of research on health. We have made a commitment to spend £16 billion over the next 10 years, and we'll be on four strategic areas, one of them being climate change and health. And that's a huge commitment for a philanthropy, and it's absolutely focused on the generation of new research. And that new research is incredibly exciting. 10 years ago, we wouldn't have been in a position to advocate for an event for a health day at COP. There is a huge groundswell in academia, in civil society, amongst government partners and others to generate the evidence that we need. A very good example, at the end of last week, a paper was published in the British Medical Journal, which for the first time, using the most up-to-date modelling approaches, showed that more than 5 million deaths every single year are directly attributable to air pollution caused by burning fossil fuels. So if we stopped burning fossil fuels today, there would be 5 million fewer air pollution-related deaths on the planet this year. That sort of evidence is hugely powerful. The health savings, the cost savings of that sort of action, phasing out of fossil fuel, and would have enormous benefits for health. So as we generate the evidence, not only on the impacts, but also on the benefits of a transition away from fossil fuel, that evidence is becoming much better, much more granular. We are supporting a transformation in that evidence base. This year alone, we'll be spending more than £100 million on the generation of new research, and much of that is where the research is most needed. So we're moving our model to fund huge amounts of research in low and middle income countries where the most vulnerable communities live and where the impact of climate change is going to be the greatest. So the evidence is now being generated. It is really exciting to see the health ministries reaching out and asking for that evidence so that they can plan to make their health systems resilient and therefore protect their people. Thank you.
And Pam, I think many people here may think of AstraZeneca as one of the organizations that really kind of led the effort to kind of produce vaccines and enable vaccinations against COVID. I think more than 3 billion AstraZeneca doses now have been administered against COVID. And yet, you're also leading in kind of trying to, for lack of a better framing, kind of clean up AstraZeneca's own house and encourage others in the healthcare industry to do the same. We know, certainly in the United States, more than 10% of carbon emissions come from the healthcare sector, and on a worldwide basis, it's more than 5%. Right? So if we're really going to combat and ameliorate climate change and the kind of carbon intensity that Alan talked about that we know is so harmful to people's health, while of course we hope that your scientists are thinking about kind of what are the right interventions and treatments to protect patient health, for a population level, we also need our healthcare industry to be cleaner stewards while doing that work. So could you share kind of what AstraZeneca is doing kind of in your own house, but also how you're helping lead across the industry?
Well, thank you, Chelsea. It's such a pleasure to be here and an honor to be here today. We are super proud of our COVID-19 vaccine journey and our contribution. Over 3 billion doses of COVID-19 vaccine supplied to over 180 countries at no profit, 2/3 of which went to low and middle income countries. And our experience through that journey, we are capturing in driving sustainability, not only within AstraZeneca, but also what we are doing to influence the sector and beyond. Alan mentioned the number of deaths a year due to air pollution. And if I may shock you a little bit more, over 7 million people in total die of air pollution prematurely every year. Another 5 million or so die from extreme heat. And in the recent Lancet countdown report, it is estimated that if the global average temperature rise by 2 degrees Celsius versus the pre-industrial levels, heat-related death would increase by 370% by middle of century. We don't have to go very far to connect climate and health, right? If you think about the number of diseases, respiratory diseases, lung cancer, cardiovascular disease due to the climate crisis, I think it's evidence for all of us to see. So at AstraZeneca, we absolutely understand the interdependency between health and climate. And this is why we are so excited. This is a watershed moment where we're putting health squarely on the agenda of climate action. So what are we doing? Our innovation and solution at AstraZeneca covers 2 fronts. One is prevention of disease prevalence by decarbonization. If we can decarbonate healthcare supply chain, we can actually reduce the amount of climate crisis-related disease burdens on the healthcare system. Number 2 is how do we better manage disease? So focusing around proactive screening, early detection of disease, and effective management of the disease. We actually work with the respiratory community, and we have data showing an asthma patient with the disease under control emits 2/3 less carbon footprint than an asthma patient who ends up in a hospital. A lung cancer patient that gets the disease detected early has a much better outcome of health and less burden on the healthcare system. Now, in order to scale these solutions, we really need more public-private partnership. So partnerships like the Sustainable Market Initiative, where our CEO, Pascal Soriot, chairs the Healthcare Task Force, we are driving the acceleration of net zero healthcare, super accelerating that. We are also through partnerships, through the Partnership for Health Systems Sustainability and Resilience, is a mouthful, PHSSR, where this is started by the London School of Economics, WEF, and companies like AstraZeneca. And what we are doing is effectively adopting digital technologies and doing evidence-based data and supporting healthcare decision makers making better decisions around building a better, more resilient healthcare system. So as AstraZeneca, sustainability is part of what we do. We've pledged $1 billion into our Ambition Zero Carbon, where our goal is to be net zero for Scope 1 and 2 by 2026. I have operations for the company, so no pressure at all. But I can tell you, we are squarely on track to achieving net zero for Scope 1 and 2. And also on $400 million we've pledged in driving biodiversity by removing 30 million tons of CO2 in 30-year period. So thank you.
Well, I look forward to seeing you back at COP in a few years when you share kind of your progress against that ambitious, but necessarily ambitious 2026 goal. You know, Angela, I know that Reckitt is also part of the Sustainable Markets Initiative, and I wondered if you could share kind of from your company's perspective why it is so important that you're a part of this work. And I also know you're very focused on kind of what you can do to both kind of reduce water waste and increase access to clean water. So could you just kind of share reflections on both of those?
Yes, absolutely. Thank you so much. And thank you both, too, for sharing your inspiring thoughts already. So of course, the SMI has been an absolutely critical vehicle to really build in that collaborative and focused efforts to make sure that we're really all going in one direction. As a scientist, having lived through so many different challenging conversations around data and facts and proof and substantiation, there's no doubt at Reckitt that we completely subscribe to the fact that hygiene is the foundation of health. And that connects us in very, very deeply with communities all around the world. And when we think about water, and it's an important element in terms of making sure that basic rights like clean water, in terms of it being able to be accessed to drive hand washing. You'd be amazed how many diseases are transferred through lack of really good hygiene practices. And so at Reckitt, we've actually spent many, many years, not just these last few, but over the last many years, teaching school-age children in countries all around the world around what really good basic hygiene can do in terms of helping them not get sick, helping them return to school, especially young girls, as we know that they're, of course, disadvantaged in a remarkable way, making sure that they have those access to hygienic restrooms, and that we can enable their long-term thriving in their communities, because we also believe that they are the future. They're going to have those next new ideas. I'll give you another really sad stat. I know you had one that you just shared, Pam, which is over 800 children we lose every day because of lack of good hygiene. And we believe that we can do a lot about that. So we are focusing a lot as well in terms of the prevention aspect. So I really like how Pam is describing how to think about disease and detection and making sure that we have early indicators in terms of where the disease prevalence will come. And we're also then thinking about prevention. Utilizing good basic hygiene is really the avenue to make it so that disease prevalence doesn't become the issue that we're talking about, that those people are not patients, that they're thriving young children and families around the world that are going to school, going to work, and contributing to their communities. So thinking about this connection between hygiene as a foundation of health, the water issue in terms of more water-stressed areas are going to cause an increasing issue in terms of hygienic conditions, and then ultimately landing in a place where prevention becomes really the place where we start from. I'd also like to just comment, I think, a little bit on Alan's comments with respect to funding, right? And this nexus in terms of there's no doubt that climate and health are in fact, inextricably linked. There's no doubt, right? And we need to make sure that we unlock the funding opportunities so that universities and academia and think tanks around the world can be leveraging those critical new funds that are now coming into the system, and doing so in a holistic way. So we're really all sort of amplifying each other's scientific research and substantiation so that we're able to ultimately really pinpoint the most intense issue so that we can really follow the next one and the next one and the next one. We've got to make sure that we're really rowing together in a way that doesn't allow silos and doesn't allow bifurcation in terms of different agendas, so that we actually get the impact that I think we all are not only hopeful for, but it is paramount that we deliver for our next generation.
You know, Alan, I wanted to also kind of ask you about the intersection of climate change, health, and gender. Really to build on kind of Angela's point around kind of Rickett's focus on women and girls in particular, because of kind of how disproportionately affected women and girls are by a lack of access to clean water and to kind of clean, reliable sanitation facilities. in school as well as in other settings. And we know now from mountains of evidence that in natural disasters, women and girls are often most affected kind of in the disaster, but also with health effects subsequent to the disaster, both for their own health as well as caregivers for their family members and communities. How do you kind of think kind of in your kind of aperture at Wellcome as you're thinking about kind of investing in kind of the research basis that we need to hopefully catalyze and sustain large systems level changes from the public sector and the private sector, and hopefully all rowing in the same direction? That gender is also a really important variable.
Thank you. A hugely important question. So at Wellcome, we have a very clear strategy on equity. There we go. Equity, diversity, and inclusion. But it's absolutely paramount to everything we do. Absolutely core to everything we do. So we often ask questions specifically to try and address the knowledge gaps there. So I'm going to give you two examples. One is we commissioned about £20 million worth of research earlier this year on the impacts, the physiological impacts of chronic extreme heat on pregnant women. Now, what we know, we can tell you exactly what happens if you take a man who happens to be a soldier or an Olympic athlete and put them in a heat chamber for a month. I can tell you what happens to that person. We have absolutely no knowledge what happens to a woman if she's pregnant and she's exposed to 50 degrees heat for extended periods of time. Because, funnily enough, you're not allowed to do that experiment. Nature is doing that for us, and there are women every day in poor countries working in the field, working in manufacture, working on the roads, working as stall holders in extreme heat. Some of them are pregnant, and we have no indication, no understanding at all on what the implications are for the unborn child or the woman herself. So there are clear implications there, and we're building evidence there. The other area I'd like to talk about briefly is agriculture. So before I came to Wellcome, I took this privileged position at Wellcome, I was a very happy professor at the London School of Hygiene and Tropical Medicine. And there I did 20 years worth of research on food and food systems. And in that, what's very, very abundantly clear is that climate change is going to have a dramatic impact on the yield of all food groups, which means that foods are going to become scarce, they're going to become more expensive, and the poorest people will be unable to respond. So using local indigenous knowledge, it's often women who are farmers, the holders of that knowledge, bringing that voice, those voices up, escalating those voices, using that knowledge is absolutely core to some of our research activities. And we think it's critical that there are diverse and inclusive voices, and we seek that the future is ethical and equitable.
Pam, I see you nodding. So I wonder too if you could share how AstraZeneca is also ensuring that the work you're doing kind of in your company as well as kind of in the world is reflective of the people who are most vulnerable to climate change, women and girls, but also our elderly, people with pre-existing conditions, and more broadly.
Thank you. And I think, one of the things I spoke earlier. Want to try? Oh, it's working. No? Maybe not? Is it? Okay. All right. I can raise my voice too. So I think, you talk about vulnerable population. Believe it or not, even in, when we think about vulnerable population, we think about developing. However, you need to understand, you cannot hear me. I'm going to switch. Okay, is that better? Way better. And I'll give it back to you after this. Teamwork. Thank you. So when we think about vulnerable population, oftentimes we think about developing countries only. Truth to the matter is there are vulnerable population in every country in the world, right? So we spoke of women. Women make up majority of the healthcare service workforce. And we cannot talk about healthcare system resilience when we don't have a resilience in a healthcare workforce as a solid foundation. So I think that this is something like the public-private partnership like the M.P.H SSR is working on, is how do we build these evidence-based solutions for a better and more resilient healthcare systems, if you will. We talked about early detection and early treatment. We at AstraZeneca have an initiative called Healthy Heart Africa. And today we have screened 9 million people with hypertension conditions that they didn't know of. So it's relatively simple and easy to get them under control. But if they go undiagnosed, for example, it can be significant burden on the local healthcare system. So things like that, I would say, are paramount as we think about the intersection between health and climate.
So, Angela, just a final question to you. You spoke about kind of your work around women and girls at the intersection of kind of sanitation and access to clean water. Kind of any other reflections that you'd like to share about how your work at Reckitt across all of your portfolio of kind of brands and geographies are similarly working either on gender or for other populations that are already vulnerable and only being made more so by climate change?
Oh, thank you so much. So I think both of my fellow panelists have spoken to the fact that when you're purposeful about it, you can do something about it, right? So understanding where those targets are. So we have taken at Reckitt a very purpose-based approach in terms of looking at women and girls in terms of opportunities. In some cases, it's education. We have several STEM programs around the world in developed as well as developing markets in terms of really training young girls to be ready for these wonderful opportunities in these jobs moving forward. We have other things where we're really putting our finances to work as well. So very, very proud that we just launched the Climate Gender Equity Fund a couple of weeks ago alongside Amazon and USAID, where Reckitt, we have pledged $3 million to really go after women-led businesses that are really there to help ensure the fact that these vulnerable populations are not only being responded to, but are leading, they are driving, they have the knowledge, they have the skill set. We need to unleash that potential in a way that's meaningful. Less than 2% of financing goes to women-led businesses in the climate arena, 2%. And yet there is so much opportunity. And when you go to different communities and you ask the question around, where do you get your health information? Where do you get your hygiene information? It's the mothers, it's the grandmothers, you know, having those conversations in their kitchens around making sure that their children have what they need to have to make sure that they live their healthy days. So we know that by rallying those communities as well and creating women leadership opportunities is going to not only be nice to have, but it's absolutely necessary to get the ultimate reach that we believe we need to have to really make an impact on the total climate, gender, and health intersection.
Well, thank you to Angela and to Pam and to Alan for this vibrant and sobering but also inspiring conversation. Thank you, Angela, for the good segue to now introduce certainly someone I'm very proud to call my mom, but also am very grateful to her indefatigable leadership of ensuring that women are not only kind of broadened from the margins, but are centered in conversations like this one, and also who is always helping me at least understand the ways in which we're all interconnected and have to, as we heard earlier, row in the same direction. Please welcome my mother's secretary, Hillary Clinton.
You all, and I am delighted that I get to follow that very substantive panel with two panelists that are going to continue the conversation. Tony Elumelu is the founder of a foundation that works in Africa and does an amazing climate health related work. Teresa Ribera, the third Deputy Prime Minister of Spain, is also the Minister for Ecological Transition and Demographic Challenge. Would you welcome both of them to the stage? Thanks. Please. You know, we are thrilled to have the day today really devoted to health. And I want to thank the United Nations Framework, CCC, for having a day committed to health, to gender, to food and agriculture. It's incredibly important that we emphasize these issues, their relationship with climate change, and most importantly, looking for solutions from the public, private, not-for-profit, philanthropic sectors. So I'm going to get right into it because the Clinton Global Initiative, as many of you know, or I hope will know, has been working in the area of climate, women, and health for many years, bringing partners together to try to find solutions based on commitments to action that groups make that will make a difference but also get to scale. And over the life of the Clinton Global Initiative, we have had commitments and the actions taken pursuant to those commitments that have affected over 500 million people's lives directly. But we're always trying to figure out ways that we can go further and include more people and have lasting change that is not going to be upset or reversed. So, Teresa, let me start with you. You have been a leader in the climate, environmental, ecological space for a long time. You've attended other COPs. How do you feel that this is the first time we've had a targeted focus on climate change's impact on health?
Probably I leave it. Sorry. Next time will be climate change and electronics. No, thank you. Thank you so much. And I think that, as you are saying, Madam Secretary, this is very important. It is very important because we need to show, to commit, and to engage to the fact that climate change also means a threat to health. Sometimes people, when thinking about climate change, they figures out that there are researchers, scientists, people looking to the clouds. And it is very difficult to connect to an average citizen of the world saying that climate change impacts on access to fresh water, on access to health, on access to food security. So it's important to show why these are items that are connected and how we can anticipate and lower the risk on the people's health, people's integrity connected to climate change. They have been commenting in the roundtable being moderated by Chelsea Clinton on the different aspects that are evidence on the cardiovascular and breathing disease connected to the changes in the temperature, in the dust in the air, the quality of the air. But I think that there are many other aspects that are slightly identified that deserve further attention. So having the research community and the health community working together with climate community is very important to learn more, to do more, and to communicate better so that we understand that this is a win-win option that we need to build.
I agree with that completely, and I also think it's important to connect the impact on health in a very direct way because we're still finding people who are not certain about what climate change actually means and whether or not it is affecting them, and linking it to disease, whether it's respiratory, cardiovascular, infectious, whatever it might be, and then linking it directly to a climate-related problem like heat, I think does begin to connect the dots for a lot of people. You know, Tony, you have, through your foundation, been working to empower a new generation of entrepreneurs across all 54 countries in Africa. And that has historically meant focusing on economic growth, economic security, jobs, incomes, but health has captured your attention. And why has the impact that climate change is having on health done that for you?
Sir Clinton, let me congratulate you and the Clinton Global Initiative for this platform. Well done. The humanitarian work you guys do, developmental work, has inspired many of us, especially in the Global South. So well done. You don't know the impact you guys are creating. I, as an African, I see firsthand, right from my youth, the linkage between climate, health, and environment. I come from the Niger Delta part of Africa, Nigeria precisely, and growing up, and to date, I've seen how environmental degradation, environmental tragedy, leads to human and health tragedies. And I said to myself, when my wife and I, in 2010, created the Tony Elumelu Foundation, again, inspired by what you have done, that we must do it in a catalytic fashion. We must do it in a manner that helps Africa to develop. We come from the school of thought that no one but us will develop Africa, and we believe that we Africans must come forward so that others can even support us. We know where and how where the shoe pinches and how it feels. And so, and my wife also is a medical doctor, and talking about the interest in healthcare. We decided, seeing these young Africans that we have supported over the years, how energetic they are, how excited they are to contribute their own quota in helping to change and improve lives on the continent. And that is a major reason we decided to prioritize healthcare. We see the devastating impact of climate change on the continent. We see how it's actually depriving people. We see floods, we see famine, we see desertification. We see how all of this, in fact, just on the 30th, just 3 days ago, the World Health Organization published a report where it stated that malaria, the prevalence of malaria is increasing further. Malaria, because of the changing temperatures, because of the harsh weather conditions, malaria control has become almost more difficult now than ever before. And we cannot talk about economic development of the continent of Africa without fixing the health sector. The healthcare sector has been very, very left behind. And that is why when we see global development institutions, platforms like yours, prioritizing and supporting healthcare delivery, we think that is one of the most critical factors we need to fix to develop Africa. That is the interest of our foundation.
Well, you have, and I know your wife has influenced you on this, but you have understood the importance before a lot of other foundations. Foundations that work on health didn't connect that with climate. Foundations that worked on climate did not connect that with health. So you have been a real pioneer in this, and we're hoping that coming out of this event and out of COP in general, you know, we can work to connect that with more philanthropies because it is an opportunity now that we have to take. You know, Teresa, I know you've been working for a long time, and congratulations on the news from last October that the European Council and Parliament reached an important agreement enabling the adoption of renewable energy. Now, many of us assumed that Europe was much further ahead than us, but you needed to have this agreement with all of the EU nations to really think bigger in how you could implement this, but it does bring you closer to the goal of climate neutrality by 2050. Can you talk a little bit about how you see the trajectory of change in Europe, and why is that crucial to our health and well-being? I mean, Tony's just talked about, you know, the need to really deal with health in order for the people of Africa to have more and more opportunities. We think obviously of Europe. Well, what does that mean? But we know that this year, 61,000 people died from heat in Europe. 61,000 people. And this is going to be a problem throughout the world. It's not just in places we think of as historically warm that are getting hotter. This is a problem everywhere. And so tell us a little bit about the linkages here.
This is a very important issue, and it helps to connect dots, which is true. This last summer, we had days with 47 degrees next to the coast in Spain, in the Mediterranean area, where normally you don't go beyond 30 degrees in summer. So it was the temperature of the Arab United Emirates, but happening in Valencia. And it's true, 2,000 people died because of the heat waves, because of the heat temperature, because of tropical temperatures during the night. So people not being able to refresh, which is good, which is needed in our bodies. And it's true that this comes back to where the problem is originated, and it is connected to climate change. Because of course, the change in the temperature parameters does come because of the higher concentration of CO2 equivalent in the air, and it creates these additional tensions with new vectors for new infections and new diseases, but also in terms of physical capacity to resist to these impacts. So, yes, we need to change the energy systems, which is not easy. That's for sure, because it is a system. So it's not just changing a plant that produces electricity by a new type of plant. It's much more systemic, and we need to do many things. But it is also thrilling and fantastic. We have the capacities to change this. We have tested, we have proven that it works. We have proven that it provides more affordable, secure, and stable sources of energy that do create less problems in the quality of the air we breathe. So we need to connect all these elements, and we need to be audacious on this. And I am very proud to see how yesterday we had very good news in the plenary, where this pledging of multiplying by 3 the renewable energy being installed from now up to 2030 worldwide, and a huge improvement in energy efficiency also shows how we can build things together in a different manner, with many other things to be worked around. But this means also innovation, work for youth, solutions that can be scalable and can also be built for small, isolated communities to ensure modern energy accessible for all. So I think that we need to make things happen, and it is our responsibility to send the signals, to have everybody on track and using their engines, their mind engines, the gray material to think on solutions.
You know, I like the comparison about what can be done to make your systems in Europe more efficient, working regionally, not just nation by nation, and really drive the kind of efficiencies and transition that is necessary. And I think making the health arguments gives us an additional way of trying to communicate both to citizens and to leaders. But in Africa, as you know so well, Tony, we still have energy poverty. We don't have energy systems that are going to be transitioned. We've got to create systems and support the necessary build-out infrastructure and hopefully leapfrog from fossil fuels into renewables. But it's a real dilemma for the continent. You know, you're experiencing a major baby boom. The median age on the continent is 19. The population is projected to nearly double in the next 25 years. And in the same period, we've got to figure out how you're going to create jobs, how you're going to educate this next generation of Africans to succeed and thrive, and at the same time, do it in a way that doesn't exacerbate climate change and the effects, which are, you know, health-related inequities and everything else. So, you know, as a successful businessman, you know, before you were a philanthropist of such note, Tony, how do you see driving the climate agenda, the health-related agenda, and job creation all at the same time?
No, Sir
A
Clinton.
simple question. A simple question.
Loaded question. But you know, joblessness is a betrayal of young ones in Africa. And indeed, you don't even see the solution, which is one of the things we try to do with the Tony Elumelu Foundation and also the coalition we're putting together so that, and as you said, we'll come back to Clinton Global Initiative to see how we can all collaborate efforts to help and make the world a better place. Youth joblessness is a major issue on the continent and is growing. And we see every day the disastrous impact of this climate change. It's affecting people in Africa and creating, even worsening the joblessness on the continent. Access to electricity is extremely poor. I mean, less than about 60% of Africans don't have access to electricity. Is that bad? And so when we talk of the development of the continent, the transformation of Africa in the 21st century, where do we begin from? Where do we really start from? You know, Spain is just about 14 kilometers away from Africa. And talking about joblessness, every day we see, we read, we hear about the problem of emigration of young ones from Africa to Europe under very harsh conditions. And why do they do this? Because they are driven by poverty, they are driven by joblessness, they are driven by the fact that there's no hope for tomorrow. So they rather die crossing the Mediterranean than sitting back on the continent and having no access to electricity, having no jobs, and being afflicted by the lack of healthcare delivery. So it's a major issue. I believe that it's almost like the Marshall Aid here. We need to all collaboratively work together, development agencies, government, great partners like the Clinton Global Initiative, and successful private sector, global private sector, to see how we can improve access to electricity, in spite of that we know there are global climate challenges, but how do we, Africa is blessed with so many, like sunlight, etc. How can we combat some of these? How can we embrace renewable energy? How can we create jobs for our people? How can we improve the economic and human conditions on the continent? And how do we make access to healthcare delivery affordable and available to people? So it's a major issue, and one I believe that should be on the table as we talk about the climate impact.
You know, I wish, you know, if I could wave a magic wand, that coming out of this conversation, there would be a follow-up discussion between both European countries and maybe the EU, plus African countries, businesses, and philanthropists, because I believe one of the models that is worth trying is to create employment in Africa for these young people. When we think about the costs, and not just economic costs, political costs, social costs of migration, on both the migrants' part, who is desperate to move forward, and on the societies that they are trying to get into, which creates all kinds of challenges. I just wish we could get more creative. And we could be perhaps then in a position in Europe to say, no, we are truly committed to helping to create employment in Africa, and we have committed to these zones. I don't know, I'm just making this up, but some kind of like opportunity zones, employment zones, whatever. And we are going to take tough positions on migration because people don't want to leave their countries, their families, you know, their heritage. But if you're desperate enough, and I have these conversations all the time with people who are very upset about immigration in our own country, and I say, you know, put yourself in the position of these people. I know you. You are an ambitious person. You are a hardworking person. You care about your family, and if you thought the only way to get ahead and care for your family was to migrate, you would. So think about what's going through the heads of these young people, because it's often the most ambitious, the most willing to uproot and move. So, and I think, and I talk for my own country and every other country that is receiving migrants, let's think creatively, especially at the time of climate, you know, dislocation. Let's think creatively about doing something to really make big investments. And I think it would be politically, you know, smart to do that. But, you know, hopefully maybe we can follow up on that. You know, and that leads me to natural disasters. And Teresa, you have been a strong voice and a leader for establishing early warning systems for natural disasters in every country by 2027. You know, what would be the benefits to our health, because we want to focus on this for this day here, of installing these systems, and what solutions are the Observatory for Health and Climate Change uncovering when you think about implementing these systems in countries?
Thank you for the question, but I'm going to go back to your previous suggestion because I think it's very important.
And I will also.
We are a little bit... No, I think it is very important. And coming back to climate, I think that there is something that should be used as a greater opportunity to build differently, what we used to call co-development. We know that for this peaceful future that we want to build around renewable energy and so on, there will be a need of new materials. It's not the traditional raw materials connected to oil and gas. You also have oil and gas. But it is this long list of raw materials that are required and that are very frequent in Africa, in many countries of Latin America. And I think that it should not be young people working on mining full stop. I think that there is a great opportunity to build through training, through creating add value, industrial services and much more connected high value opportunities that should remain at home, and a much more balanced approach in trading. So I think that there are things that we need to explore differently, because it's true that when we talk about the impacts of climate change, everybody tends to think this is local impacts. It's not true. The local impacts do have an impact beyond our borders, because flows of water, people desperate that do not have access to food, of course, they go to other places or they miss traditional ways to access to those rivers or whatever. So I think that it is worth it to work in this 14 kilometers difference between Gibraltar and Africa. That's my comment. But yes, I think that we need the public health services used to be, I don't know, the small sister in any health system in our countries. And the pandemic, COVID, and climate, air quality related diseases are such a big proof on to what extent we need to invest much more in updating the way we learn at the medicine schools, the way we develop health policies to take into consideration all of this, the way we anticipate what it may mean and how we can anticipate what it may happen. So yes, the early warning systems are very important, and we should have in every single country these early warning systems. This is a proposal coming from the Secretary General of the United Nations, and I think that we need to push for that. It's so easy to count on that. And then to develop, but the primary response is not so difficult to be built, and it's something that deserves our attention. But the second thing is that, yes, we need to learn a little bit more what are the relations between climate change and the health of the society, and how effective our responses are. And this was why we decided to create this observatory on climate and health, to be able to learn, to have figures to improve the policy response, including, of course, the early warning systems. But I think that we know enough to do much more, but we still need to know much more to be more effective in the response that it deserves.
Tony, do you want to add a comment?
Yes, I think you hit in there. This issue of joblessness has many implications. Europe in particular, the migration issue. And I believe that something should be catalyzed from this conversation. Our foundation will be willing to partner with the Clinton Global Initiative, and I'm sure governments also, Europe, etc. We did something recently with European Union, European Commission, where they contributed, they brought $25 million, we might $25 million or so, and we're able to support over 5,000 young entrepreneurs in Africa this year. I will give each of them $5,000 non-refundable seed capital. We train them for 12 weeks. We appointed global mentors for them. All we want them to do is to embrace green economy, and more importantly, help to create jobs, employ people, create jobs, because ultimately, this is the way to help develop, and more importantly, to stem the migration, because it is, as Secretary Clinton said, a major issue. The people who are migrating and where they're going to. It's even bigger challenge there. So the earlier the world comes together, I would like us to really invest a lot in advocacy and resources to make the difference. So that's the comment I wanted to make.
Well, we will be following up with both of you. And now I think we were expecting Dr. Tedros. Is he here? What? Oh, he can't make it. Oh, well, I want to, just conclude this important session and the one that Chelsea moderated before by underscoring what is obvious to all of you here because you're here. But we have to do a better job communicating this. And Teresa and I were talking backstage, and I have to admit, those of us who work on these issues, care about these issues, see the interconnectivity between climate and health and joblessness and inequality and all of the rest of it. We have not done a good enough job communicating that. And out of this COP in particular, since we are talking about issues that are definitely related to climate, but most people don't necessarily understand that or see that. How can we do a better job? And there's a lot of really talented people among the 110,000 registrants for this COP, which blew me away. There's a lot of really talented people, and we all have a stake in making the case better than maybe we have in the past. Negative messages are just so much easier. But I want to just end because these two people are so knowledgeable and so effective in what they've done. So I just want to give the last words to them. How can we do a better job, communicating, first of all, to people, but secondly, to leaders, what's at stake when it comes to our health? How would you do that, Teresa?
Well, that's also for the next workforce that we are going to organize, no? Yes.
We're putting it on the list here.
Putting it on the list. No, I think that this is very important. And the reason why we move forward tends to be more effective when it is a positive reason than when it is a negative reason. That creates much more innovative approaches, audacity, and so on. So I think that it is very difficult to stick to, this is horrible and we have a problem. We need to go beyond that. And at the same time, I think that we need to pay attention from the roots, what the young people, what the small communities, how they see the problem, because this is the way to think in a much more strategic manner how we communicate up to the leadership why it matters. But it has to be simple, it has to be concentrated and credible, and according to my own understanding, it is better if it is positive.
Tony, last word.
Yes, thanks. I think, as they say, if you want to go far or fast, you go alone. If you want to go far, we go with people. For this to succeed, we need a coalition. We need a global coalition, North-South coalition. We need our women, our young ones, our private sector people, development agencies, and government, all of us coming together to propagate and let the world know, as we do see every day in our respective communities, that climate change is real. It has telling impact on health. It has significant impact on joblessness. It has huge impact on security. People who are deprived from their economic opportunities take to extremism. We have seen, I have seen it, it's happening in Africa, how extremism is being fueled by poverty, is being fueled by desertification. If you look at the Sahel region of Africa, they suffer the brunt of climate change the most, and insecurity is highest there. So there's a positive correlation. We need to come together. We need to come together so we can go far and be more impactful as the world. Thank you.
Well, I can't think of a better note to end on. Thank you both so very much, and thank you all for being here.